Hey everybody, I'm Mike Antal. I am the primary instructor for the shoulder course with Great Lakes Seminars. Today I just wanted to go over a taping technique that we use to help with AC stabilization, acromioclavicular joint stabilization. For those of you who have maybe taken a couple of our courses and have gone through some of these taping techniques, the way we taught it in the course, which is very effective, is a piece of tape that goes from the deltoid tuberosity up onto the AC joint to help pull the head of the humerus upward, because when we have somebody who has separated their AC or sprained, the rotator cuff in many cases will become inhibited, which then allows for an inferior subluxation of the head of the humerus. So we do a piece of tape to try to pull the head of the humerus up. Then we do another piece of tape pulling back to help set the clavicle back down on the acromion and to help with the posterior rotation. That's the way we teach it in the class. Recently, I've come across another way to tape. I was teaching a course and one of the participants showed me another way to do this, and it is fantastic. So I'm going to give you a real quick view on how to do this. All right. So with this taping technique, it's very similar to a kinesiotaping technique in that we put the patient so that the muscle's in a shortened position. So I have the patient with the arm abducted. I take a piece of my cover roll. This is done with Leukotape. I take a piece of my cover roll and I make sure we're covering the clavicle and the AC joint. Doesn't even have to be this long, but not bad to make it longer with the cover roll, because this is the stuff we don't want to put it right on the skin to protect the skin. So this will make sure we don't get it on the skin. The Leukotape is going to come from the AC joint down to the deltoid tuberosity as your target. Okay. I'm going to start at the top to make sure I'm on that clavicle. Then I'm going to give a little bit of a tug down to create some tension in the tape. Then all I'm going to do now is have my patient go ahead and move away from the table and let that shoulder come down. What this does, and the reason it does such a great job of stabilizing, is because the Leukotape is a rigid tape. As the patient brings the arm down, there's no stretch on the tape, and it pulls the clavicle down onto the AC joint. It works great. The other thing, if you really wanted to promote that external rotation of the clavicle, you could always put the other piece on as well. So I hope this was helpful. It's a great way to stabilize that AC joint, and it's very quick and easy. Thank you.